Hello, I'm Joseph Albert, Editor-in-Chief of the American Journal of Medicine, and I'm with you again this month to call attention to what I think was one of the more interesting articles in this month's journal. It's from the Mayo Clinic in Rochester. It's DiMichele et al. And senior author is the good friend Alan Jaffe, who I like to jokingly call the king of troponin. They looked at a large database of individuals who came into the hospital with atrial fibrillation and had a bump in the troponin, so-called type 2 MI. We see this all the time. Patient arrives at the emergency room, they're in atrial fib, their heart rate's 150. Eventually, we get them back to sinus rhythm at a reasonable rate, and there is a bump in troponin. They've had a myocardial, usually what we call a non-ischemic myocardial injury or a type 2 MI. In other words, it's not a ruptured atherosclerotic plaque that requires a trip to the cath lab. Well, what's interesting here was that these individuals who had atrial fibrillation and had a bump in their troponin, and not all of them had a bump, but the ones who had a bump almost invariably had structural heart disease. They had left ventricular hypertrophy, they had had previous myocardial infarction, they had some abnormality in the heart, implying that when you see a bump in the troponin in somebody who enters like that with atrial fibrillation, it means that there's structural heart disease underneath and the patient needs further workup to evaluate what is going on with the structural heart disease. Sometimes it's the first time the patient has discovered that they had a structural heart disease. So it's an important marker, as troponin so often is, and particularly in this setting of atrial fibrillation. So I hope you enjoy the article. I think it's going to be some useful information in clinical practice, since atrial fibrillation is so common, both on an inpatient and an outpatient basis. Thanks very much for staying in touch with us on the American Journal of Medicine through our various social media aspects and through the journal. And we look forward to talking with you again next month.